This presentation covers the proposal on cross-theme working by the working groups. My name is Esther Mary Darcy and I am Chairman of the European Region of World Physiotherapy, and I am delighted to present this proposal to you, the member organisations, for your consideration. You will have the opportunity to discuss this proposal in the second discussion of the General Meeting on the afternoon of Friday, the 9th of October. In this presentation, I will cover the background, the rationale for cross-theme working, and the rationale for the choice of themes, and finish by providing examples of how this would work. Firstly, to the proposal itself. This proposal is that the three working groups would focus on two significant themes during the next term: cancer and musculoskeletal disorders, which would be covered from the different perspectives of each working group in order to enhance the promotion, recognition, and impact of the role of physiotherapy in both themes and the profession as a consequence in the European region. Looking at the background to this proposal, the structure established by previous executive committees has served this region well, and we in the executive committee were keen to maintain and to enhance the functioning of the working groups and to review it. This seed came from an exploration by the Professional Practice Working Group back in 2018. The kernel was then brought to the Executive Committee, and it was agreed there that it would be really helpful to get the views of all three working groups, giving us a larger and more diverse audience for exploring. Overall, the three working groups gave a positive welcome to this proposal and indeed worked to expand it. Their feedback was collated and reported to them at the end of the joint working group meeting, and based on their feedback has been refined and was agreed by the executive committee that it would be placed before you for your consideration as part of the recommendations of the working groups for the next term. In looking at the rationale for cross-theme working, we looked at several perspectives from the working groups themselves as part of the revision of their function, you, the member organisations, and the promotion of the profession in Europe. So overall, the idea of cross-theme working is in line with the European Region of World Physiotherapy strategic objectives, and naturally in line with WCPT. It's also a way of acting strategically, developing a high-level aim, such as those associated with Goal 3 of the Sustainable Development Goals 2030 and other related goals of WHO Europe and the European Union. Focusing the workload of the working groups would increase the impact of the work and would help to give added value to the profession in Europe, and indeed to enhance the promotion and the recognition of the profession in Europe. And while simultaneously it would help to maintain the working groups as fit for purpose. Also, it would maximise the collective potential of the working groups by contributing to a single theme from their distinct and respective perspectives, knowledge and expertise. So we would be covering each theme from the aspects of sourcing and collating the evidence through the Education Matters Working Group, disseminating and promoting through the Advocacy and EU Matters Working Group, and advocating and influencing through the Professional Practice Working Group. Also, the convergence of work with a common purpose would represent a joint effort on behalf of you, the member organisations, and would also hopefully provide you with a body of work that you could use in your respective countries when you're lobbying and advocating for resources. And lastly, that it has the potential to have physiotherapists with theme-specific expertise on our working groups for the next term. And so in the call for working group members, which will come immediately after this second part of the general meeting, we would specifically be asking and including in the call for working group members that attributes related to each of these themes would be desirable. Looking at the rationale for the theme choices themselves and how we chose these themes, if you, the member organisations, accept that we would proceed with this proposal and pilot it for 1 or 2 terms, these are the themes that we would work on. We looked at a lot of themes and the working groups suggested some, and in the end, the joint working groups left it to the executive committee to make the final decision about the themes. So in a way, the 2 themes aren't actually up for discussion. It's really the whole idea of cross-theme working that is up for your consideration. So I hope that this explanation is sufficient as to why we chose these 2 themes. Firstly, they cover major physiotherapy practice issues, and there is strong evidence for both of these for physiotherapy. We also thought that physiotherapy is a major profession involved in the 2 health areas and makes an enormous contribution in both prevention and treatment. And it is aligning, or would align, the work of the working groups to the future direction of healthcare. We know that there's a societal value of physiotherapy in both themes, and there are also World Physiotherapy subgroups related to the themes, and many member organisations have related interest groups. In both of these themes, there are several organisations within Europe that are relevant to the themes, and which the European region could actually link with or join with to benefit from, or indeed to contribute to. While the knowledge of the evidence on the role of physiotherapy is very well known in musculoskeletal, it's not as well known in cancer, and we thought that was provided a need to, or a way to demonstrate the evidence for physiotherapy in the patient with cancer. The evidence could be used to influence funders, like the politicians in your own country, for example, to convince about the cost of effectiveness of physiotherapy in these themes in both prevention and treatment. And we thought that would be very helpful to you, member organisations, when you are looking for resources. There are also politically important themes in Europe at the moment, and as such have a greater opportunity or possibility, I suppose, of attracting supporter funding, and of influencing and impacting and enhancing the profile of the profession. And the European Beating Cancer Plan, which is the big initiative of the European Health Commissioner, is one example, and the OSHA MSDs in the workplace is another example of European working. So I suppose putting all of that together, the objectives would be to enhance the promotion of physiotherapy and indeed the profession in the European region by focusing on a concentrated approach to two health areas in which physiotherapy has a significant role, and thereby enhancing the recognition of the role of physiotherapy in both of these areas, and ensuring that every patient receives the physiotherapy to which they're entitled in relation to these conditions, and to enhance and maximise the impact of the work of the working groups, and to align the core work of the working groups. This isn't the only work that the working groups would be doing. They obviously have the other areas of work which you will see in the recommendations to continue work that they're doing, to start some new work. But this would be aligning their work with the focus of global and European targets for health, including the Sustainable Development Goals, the WHO 10 global threats, or 10 threats to global health, the WHO 9 voluntary global NCD targets for 2025, and Health 2020, the European policy for health and well-being. So just to give you an example, we asked each of the working groups if they would look at 6 questions from their perspective of their working group, both in cancer and in MSDs. And what we're presenting here are just 2 examples. So this is from the professional practice working group looking at cancer, and the other example is from the Advocacy and EU Matters Working Group looking at MSDs. So the questions are the same in each case. What do you want to achieve? And this was to enhance recognition of the role of physiotherapy in cancer prevention and the care of people living with cancer. The target audience, primarily you, the member organisations, strategic partners, and the public, policymakers. And then secondary target audiences would be patients, the public, and other health professionals. Relevant stakeholders, specific interest groups, the WPT, international and the national member organisations, as well as academics and researchers. What is the current state of the theme? There's strong evidence for physiotherapy in cancer. There are strategic documents. The awareness of the evidence and strategic documents with regard to physiotherapy obviously is low, and the implementation of interventions based on the evidence and strategic documents is low, and the access to physiotherapy is not equal across Europe. And what actions needed to be identified for implementation? So each working group was asked to develop the strategic actions for their group. And the professional practice working group identified that they need to collect the evidence and the documentation that underpins the role of physiotherapy in the care of people living with cancer. That they need to raise awareness of the evidence supporting physiotherapy for people living with cancer, and to advocate for equal access, and to encourage and support member organisations to promote the implementation of the evidence and to advocate for equal access. And then the evaluation would be, firstly, to develop indicators of achievement to measure the impact of that work. And then in the Advocacy and EU Working Group Matters, this is their example in terms of MSDs. Again, about enhancing the role of the profession, and also to position physiotherapists as stakeholders in the process of pain management, in the role of cost-effective management, in relevant campaigns, such as I've mentioned earlier, OSHA campaign, promoting physiotherapists in self-management through educational materials, their role as enablers of a personalised approach to MSD management, including the wide variety of skills that we have, or the diverse variety of skills such as motivated interviewing, patient activation, shared decision making, and social prescribing. The economic value of physiotherapy in the management of MSDs, and how it actually has a positive effect on the individual's ability to return to work. And lastly, the role of physiotherapists as communicators and the importance of improving patient health literacy through empowerment to reduce the risk of suffering from MSDs. Target audience, primary audience, again, member organisations, strategic partners and policymakers. Secondary audience, patients, public, physiotherapists and other health professions. And what can assist this group in doing that? So special interest groups at WCPT level and at member organisation level, academics and researchers, relevant employers and employee organisations, medical professions at national level, international student organisations, and organisations that look at workplace quality. And then the other three questions about the evidence. Obviously with MSDs there's very strong evidence with a lot of strategic documents, and there are great opportunities in that there are new ways of delivering, for example through telehealth, group work, and the implementation of interventions based on this evidence and strategic documents is low. So again, as with cancer, the access for physiotherapy is not equal, and the model of delivery of services is not equal either. This group would again collect all of the evidence and strategic documents that underpin this. They would have a database of models of MSD services across Europe that highlight best and emerging practice, and a database of possible allies, and assess the most strategic partnerships available, promoting the implementation of the evidence and advocating for equal access, and encouraging and supporting member organisations to promote the implementation of the evidence to advocate for equal access. And lastly then, about evaluating it, again, each group would have to develop indicators of achievement to measure the impact of the work. So we are looking forward to hearing your views on Friday the 9th of October at the second discussion, and we will be asking these questions. So we hope that perhaps before this that you have an opportunity within your member organisation to have a discussion on this and to come with your answers. Thank you for your attention, and I look forward to discussing it with you in early October. Thank you.